Evening from wherever you're watching from. Welcome to You and Your Health. Welcome to yet another edition. You and Your Health is a program designed for us to bring light to health matters as it spans from awareness, prevention, diagnosis, maintenance, cure. And as well, it brings a healthy balance from the area of science and spirituality when it comes to health issues. I welcome you once again, and I'm glad to let you know that you've tuned in at the right time. My name is 𝗪cie𝗿𝗶𝗵, and I'll be your host today. And with me in the studio is a well-read medical practitioner who will be taking us in a deep dive to our topic for today. And our topic is sickle cell disease. Sickle cell disease, a very timely one, I must say. Welcome with me, Dr. 𝗪cie𝗿𝗶𝗵. Welcome, sir.
Thank you.
You're no strange face here, but we'll still love to know a bit more about you for the purpose of our audience.
Here in Redemption City, Ogun State.
Welcome, sir. It's good to have you today. So this is the very first edition we're having in the month of June. In our last edition, we spoke around infertility, the definition, the prognosis, the types, being that there's primary infertility, secondary infertility. We also spoke about the support system around people having such challenges and even the possible solutions for infertility itself. And today we have an interesting topic, sickle cell disease. To start off, I'd just like you to please speak on it. What exactly is sickle cell disease and how does it affect the body?
Thank you.
Yes, sir.
Sickle cell disease, sometimes it can be called sickle cell anemia. It's a genetic disorder affecting the production of hemoglobin. Hemoglobin is a substance that makes the cell red. Okay, and that is the substance where you can get oxygen, that takes oxygen too. So it is a problem of the production of this hemoglobin, all of it abnormal hemoglobin. How do you mean by that? At a point in time, you know, all these things are changed. The amino acids or the elements are arranged. The elements in the bodies are arranged in molecules. And at a point in the arrangement, in the production, there is a mutation, that is, there is a distortion in that arrangement at a point, on a point rather. And usually, when there is a mutation in that arrangement, then there is another arrangement of or substitution of amino acid. Sorry, I'm going a little bit deep so that we can understand it.
Yes, sir.
It's a chain, but something happened at a point, and that point is at point 6 of the amino acid chain. And then something happened there, and the glutamine that is supposed to have been there is replaced with valine, and then it changes the shape of the blood. Usually the blood is shaped as spherical. It's spherical in nature, but when this happens, that is this distortion occur, the shape of the blood now altered. It's no more, it will no more be spherical, but sickle. That is why it is called sickle cell. It's sickle. What do you mean by sickle? It's like C shape. You know, in the old good days, we have farmers who use sickles to harvest grasses. So the shape is C shape, and usually that shape, it assumes, makes it or makes the blood harden, the blood cell harden, unlike the normal cell. The normal cell is flexible, elastic. It can go through tiny holes. But this one, because it is sickle, because something has happened and there is a clumping together of cells, then it becomes hardened. The sickle is hardened, that is number one. Number two, the sickle can block, because it's no more elastic now, it can block the supply of blood to a particular place. It can block the supply of blood to a particular place. And that is what you see when they have crisis. When they have crisis, there is a blockage, or there is a source supply of blood to a particular place. It can be bone, it can be abdomen, it can be anywhere.
Wow.
This has blocked that place, and that is why there is problem in the place. So usually it is spherical blood. Normally it's spherical, but in sickle cell it is not spherical. It is C-shaped, and it is hardened, and it can easily block the cell of the blood vessel. Apart from blocking the blood vessel, it is also liable to what we call hemolysis, to breaking down earlier than the normal blood cell. Usually blood cell breaks down at the end of 120 days. But this one will break down before 120 days. Usually after 120 days, blood is produced. For 120 days, it's 120 days a lifespan of it, and it breaks down and is used in another place in the body. That is what colors our body, our stool, to become brown. It is the breakdown of the blood. But for sickle cell, it breaks down earlier, and then there's increased iron inside the blood of the sickle cell patient. Of course, it is a genetic inheritance, recessive genetic inheritance. What I mean by recessive is that the two parents has to contribute their S. This one contribute S, this one contribute S to become SS. And then the fellow has SS in the body. And usually the parents is either AS, marry AS. And so they can easily contribute SS, one S from the husband, one S from the wife. That does not mean that AS will always give birth to SS. No, that does not mean. They can give birth to AA, they can give birth to AS, they can give birth to SS. But to avoid the chances of SS, I think it's not advisable for AS to marry AS.
Wow, thank you very much. So that's a very solid introduction to it, and I must say, from the definition and taking us deep into what makes up the sickle cell disease, it shows how grievous and how life-threatening it can be. And that leads me to the question that, we hear of sickle cell disease and sickle cell trait. Is there a difference between the two?
Yeah, there are differences in the two. The sickle cell disease is the one that has double S, SS, as the genotype. Usually we have genotype blood AA. We have genotype blood AS. We have genotype blood AC. We have genotype blood SS. It is the SS that is the disease. The AS is a carrier or trait. Yeah. Occasionally, AS can become advantageous, but occasionally they can present mild crisis, not as deep as the SS, but they can present mild crisis. But for AS, particularly in our malarious area, is an advantage.
Wow, thank you so much, sir. The issue of sickle cell is one that, if you are not affected directly, you might end up knowing one or two people because of how prevalent it is, particularly in Africa. And according to WHO, it spans that about 240,000 children are born with sickle cell annually, and that's a high percentage according to their research. And this brings me to the fact that in Africa, streamlining to Africa now, we know we're speaking to a global audience, but because of its heavy prevalence here, there's this sort of stigma that patients who have sickle cell experience, maybe from friends or from the society at large? Do we say it's a cause of lack of awareness, or they feel that these people are eventually going to die? Because that's what some people categorize them to be. So I'd like you to speak on that, sir.
Well, they actually there shouldn't be any stigma against them. There shouldn't be. Rather, there should be pity. Because if you have seen them in their crisis, you won't stigmatize them. You rather pity them. It's so painful. Or if you have a loved one who is undergoing such a pain threshold, you will not stigmatize that fellow. And of course, sickle cell diseased patients, they don't need to die. Death can be prevented from them. And they only die of infection. They die of infection, particularly if there is no adequate treatment. There are doses, there are management that the sickle cell disease can undergo that will prolong their life if they stick to it. Well, of course, poverty, but those drugs are cheap. Those drugs are cheap. So if they go along with those drugs and they heed to the advice of medical practitioners. For instance, sickle cell should not undergo rigorous exercise. Rigorous exercise to the extent that they will be dehydrated. Dehydration will enhance a crisis, because if they are dehydrated, it means the blood vessel will not be flowing very well, and they can easily block each other. They can easily block a particular organ, getting supply to them. So it is better they live without a rigorous exercise. I'm not saying they should not exercise. That's not what I'm saying. But a rigorous exercise. And if they must exercise, they must rehydrate immediately. Water must not be, or fluid must not be far away from them. They rehydrate immediately. That at least will solve the problem.
Solve the problem. Well, thank you so much, sir, for that. I'd like to just re-echo what he said. He said that they should not be stigmatized, rather they should be pitied, because they go through a lot. And death is not the end for anyone that has this disease. Life is possible. Life is, will I say, accessible. Life is assured as far as they do the necessary things. It is a lot, I must say, sir. And that brings me to the point where we want to ask, sir, what are the early symptoms? How early can it be detected? Probably in infants and newborns. How early, and what's the diagnosis procedure for sickle cell?
Usually the symptoms are pain. Pain as a result of crisis. Like I said earlier on, because the blood is, the shape of the blood is sickled, and because of the tendency to fragility and the tendency to block the vessel, there is pain, and usually it's either bone pain or abdominal pain. Of course, the blockage of blood supply can be to any organ, but usually it's to the bone and to the abdomen. They usually have. But to solve the problem is you rehydrate the fellow, give bone, give analgesic to reduce the pain, rehydrate very well. Then so number one is the pain crisis. Number two is there are some of them, their 𝗪𝗁 is different in childhood. When you see them, spot diagnosis, you can easily know that this one has, they have overbiting teeth, they have a caricature that you can easily know. I mean, those of us that are in the medical field, you can easily know. But usually, they are prone to anemia. And 2 or 3, they are also prone to frequent infections. And the last, which is not too common, but can be available, is what we call priapism. Priapism means sustained erection, and it's so painful.
Wow.
Yes, because of blockage. It's sustained erection. Sometimes it can lead to doing a little bit of surgery, and you may not be able to have erection again. But priapism is possible among them.
Thank you so much, sir. One major thing you said is pain. The occurrence of the crisis itself, it's a clear pointer that, oh, this person might be suffering from a sickle cell disease.
Yeah.
And I would love to ask, flipping the coin, is it possible to, have sickle cell disease for years without knowing?
Yes, it's possible. Yes, it's possible. It's possible. But ideally, with the advent of medical education, medical availability today, I don't think it is necessary. I think as early as possible, people should know their genotype. You should know their genotype. It's possible, particularly if the fellow is living well, if he's not exposed to stress, not dehydrated. It's possible, but very rare anyway. Very rare.
Wow, thank you so much, sir, for that. And it boils down to knowing your genotype early.
Yeah.
If I must say, if it's possible that as a child is being born, let the test be done from the hospital. So as they're giving the birth certificate and all the details, let that child also know. Because I recall when I was in the university and we had to take tests for medical reasons, just for documentation in school back then. And almost everybody was AA. That was the first shock for me. I was like, is it possible for almost 5,000 students in my level then to be AA? And personally, I told myself that most of these things might not, probably because of the African thoughts in me or the Nigerian mentality I had back then. But I realized that when some people went back to, have a second check, and they realized that, oh, they were actually AS or they were AC. And an AC is one that is not so common, so to speak. We usually hear of AA, AS and all. And that brings me to this point, because the decision can be made early not to have a child that will have this challenge. Well, how then can, oh yes, we've discovered that you are AS, your partner as well is AS. What can be done if they want to pull through or go through with the wedding, with the marriage, and also have children in the future?
Yeah, that's going to prevention now.
Yes, sir.
I think the best arena is when about to get wedded. Or maybe I should say earlier before wedding. The moment you come together as lovers, because you don't know where that love is going to. It's better you know your genotypes with that. Yeah, it's better you know. And the lovers can easily know by asking questions. Do you know the genotype of your father? Do you know the genotype of your mother? Once they are AAAA, we can assume that she or he will be AA.
Yes, sir.
So at least asking that simple question will lead us to a lot of discovery. You want to know, I want to marry you, for instance. I say, okay, do you know the genotype of your father? Do you know the genotype of your mother? And you ask me the same thing too. That question on its own can lead to another question. Then you can say, okay, maybe we should go and do test. Maybe we should go and do test as early as possible in the love life. So the best for the society is that AA should marry AA. Then they will produce AA.
Yes, sir.
All true. But where you have other different genotypes, AS should not marry AS. Neither SS should marry SS. One SS marrying SS will produce children of SS, all of them.
Yes, sir.
Because the two parents are SS. So one will contribute one S, the other one will contribute another S, and so the product will be SS all through. For AS, the possibility of that generation, AS marrying AS, is that they can produce AA, they can produce AS, they can produce SS in chance. The chances of AA is about 50%, the chances of SS is about 25%, and the chances of AA is about 25% for AS marrying AS. Those are statistics. And statistics is not a fact anyway. Statistics is not the truth. The truth is when the thing has happened. Yeah. So, but you, based on statistics, you can say, okay, if AS marry AS, you can have 25% of AA, 25% of SS, and then 50% of AS. But the best is AA can marry SS, AA can marry AS. I think that's the best. So if we are able to cancel each other before marriage and when going for marriage, and religious center should be able to stand on a particular stand, on a particular leg. Okay, we don't want our SS, we don't want our AS to marry AS. They can say that. The religious organization can say that. We don't want, because we don't want to produce abnormal children. Well, of course, that is not also, it's not a yardstick, because I have a daughter in the Lord who was AS, want to marry AS. I advised her, she didn't heed. He said, join your faith with my faith. I said, okay, after I've talked, but good enough, they all have AA.
Wow.
Not good enough. So sometimes, faith can override some of those chances. Faith can override it. That's where faith comes in. But good enough, you should be able to advise, counsel on the marriage, whether to marry or not to marry.
All right, thank you so much for that. I'd love to pick it up from where you stopped in the aspect of faith, because we have people that maybe not entirely because of faith, but because of the love that has been established. They are like, oh, where do we start from? We've come a long way, and turning back is not an option right now. So are there things they can do? Are there precautions they can take that will, better off their outcome? I came across a video not too long ago, that was yesterday, coincidentally, and the lady said that she found out 2 weeks before her wedding that her and her partner both have AS as their genotype. And because of how far they've come and the level of knowledge they've built, they decided to go through with the wedding and the marriage. And they tagged it as having expensive children. Why? Because they decided to consider IVF. So I want you to speak from that angle, sir, because we might have 1 or 2 people watching us that are at that point, that breaking point where going back might seem so difficult. And they may not necessarily have so much faith to go on that journey. Is IVF an option, speaking from a believer's angle now?
Okay, speaking from a believer's angle, let's start this way. That marriage should be, you should be able to hear from God. And the moment you say, go ahead, you can go ahead. It doesn't matter what the disease that fellow has. So as a Christian, as a sound Christian, whatsoever you are doing, you must get something or voice from the Lord. That's the first thing. But where you have not been able to get voice, or maybe you have gone deep into it before you even got saved to that extent, and a point of no return has actually come to the two of you. Well, there are, in fact, these days, just like you have said, IVF, yes, and some people you can even test embryo to know which one has SS, but it's not for Christians to do. Because life has gone into it. Life has gone into it. The moment fertilization has taken place, it is not of you to go and destroy life. So we have to be very careful. It's not everything the world is doing that you will subscribe to. For instance, in our facility here, we know that IUCD is a form of contraception, family planning. But we don't do it. And the reason is this. IUCD does not prevent fertilization. Fertilization will take place, but it prevents implantation. What life has gone in initially before it comes to implantation. So we have to be very careful. And the Bible says, "You that shed blood, his blood shall be shed too." So I think we should be very careful at determining what to do, so that we don't unnecessarily take life that should be sacred, sacrosanct. So we should be very careful.
Thank you so much, sir. I love the healthy balance you brought to it, particularly when you said you must be able to hear God. You must be able to, because I've heard of a testimony of someone that was SS, and with faith, with prayers, and with agreements with a partner, they prayed towards it, and before the wedding, they took another test, and it had changed. So that shows that what science cannot do, God can do.
Oh, yeah.
And there's a limit to what science can do, and that is why precautions are everywhere. Or if you do this, 1 + 1 may obviously get to 2. But when it comes to God, 1 + 1 can be innumerable. Thank you so much for that balance, sir. And, you know, I'll take us a little bit back from what you said earlier. You said the medications, the treatments are very accessible. They are relatively cheap, so to speak. So now this brings me to another angle of two people deciding to get married on the basis that since the health care for sickle cell patients are very accessible, we can manage this. In bringing forth children, consciously knowing that they will be sickle cell patients, and with the end goal that, oh, the treatment is accessible, so it can be managed. Is that something that is advisable, one? And is it looking forward in the years to come with the innovations coming into science and all? Is it a point we can get to where people can make conscious efforts or conscious decisions to, you know, go ahead to have sickle cell patients, knowing fully well that there is a facility or treatment to help them thrive?
Yes, sciences are developing. They are not static. There is what we call stem cell implantation. Stem cell is a cell that can, it's a cell of the embryonic origin that can transform. You know, human beings come from just one cell before head, hand, or the other organ comes in. So the cell that formed that before the other organ comes is called stem cell. That is from where they stem out. Now, you can harvest stem cell and implant in human being. Again, that has ethical issue. Where do you get the stem cell from? You get it from embryo. So, are you going to kill the child? Where do you get the stem from? You get it from children. Are you going to kill the child? Where do you get the stem cell from? You can get stem cell from the bone of a child and implant. In fact, study has gone, or development has gone to an extent that you can even use that stem cell to cure liver disease, whereby you implant it and that liver grows a normal liver. But where do you get them? That's the question. That is where the ethical issue comes in. Are you going to be killing children and storing them, because of the stem cell? That's where the ethical issue comes up. Yes. Otherwise, those things are possible. There are possibilities here and there. Stem cell implanting. But where do you harvest the stem cell from? That is number one. Then that is the extreme of it. But on the normal basis, if I'm not too sure if a couple will want to produce, if you have ever seen where sickle cell patient is in crisis, you will not want to dabble into it. You will not want to try it. Particularly those children being your own. You won't. It's better the emotion goes. You let the emotion goes, depart on that emotion, and you go and marry the fellow that you will not have problem with, producing problematic child into the nation. I think with the advent of things now, knowledge has gone to a place whereby we should be reducing the population of SS, not increasing it.
Yes, sir.
Not increasing it. And some people will say based on love. Love is okay. Maybe I should say love is in the mind, and those things can be erased. It's in the mind. Those things can be erased, except you don't want to have children. That's a different issue. You can have love. You can marry and say, okay, no, we are not having children. We can adopt. That's a good thing. That's a good thing. You can adopt. But going for SS marrying SS or AS marrying AS, and you are not sure what you want to stage manage. You want to stage manage. What is the stage managing? Supposing it is SS, when your wife is pregnant, you test the baby, and the baby is SS. You want to kill the child? That's where ethics comes in.
Wow. Thank you so much for that. And, you said that let the emotions go. Yeah. Because that's where the struggle always is, the part of the emotions. And, while you were saying that, it just dropped in my heart that even seeing the outcome, seeing that child in crisis will frustrate the love that you claim to have. Yeah. So why not just avoid it in the first place? And now this brings me to the question, because we've been speaking on the crisis, the pain, the symptoms, and the likes. How can patients, people that have been, diagnosed to have sickle cell disease, how can they manage the crisis? Are there home remedies, or how can it be managed at home and even in the hospital?
Yeah, anybody that is diagnosed to have sickle cell, you should not be far away from the hospital. That's number one. Particularly for advice and for particular drugs. Usually, those in SS cases, that's why I wear this cap. Immunization. They cannot do without the immunization in childhood. You must not miss any. Because they are prone to infection. And so the best way to prevent infection is to immunize against that infection. So immunization is key and a key issue in managing sickle cell cases. Then medical advice, don't do this, don't do that. When they are going to school, you get a letter for them. This is a known so. You should not go rigorous in the exercise. And in case he goes rigorous, there must be something to rehydrate him or her immediately. There are drugs for it that they will be replenished, taken every day, just to be able to replenish, because they are usually anemic. boost their PCB, and they should eat well. They should eat well, good food. They shouldn't be far away from the hospital. Yes. And don't be, the moment they get to certain age level, between 18 to 20, you can be assured that survival rate is very high. Very high. The ones that usually succumb to them die before 5. Yeah, because of infection, because of pain here and there, something like that.
Thank you so much, sir. And speaking on they being prone to anemia and being anemic, I'd like to ask, what is the role of blood transfusion in treating?
Yeah, you need, if they are anemic, you want to transfuse AA, genotype AA, at least to reduce the. Of course, that AA will die within some few days, but at least
for the meantime,
can transfuse them when it gets to a level. Can transfuse them so that you suppress or you reduce the number of SS there and put AA in, and at least life will go on. That does not mean that transfusion has its own side effect too, but then if it's done in the hospital, those side effects will have been taken care of.
Thank you so much, sir. And now, this brings me to the question that I believe is in the hearts of those watching us as well. Is there a cure for sickle cell? Because some speak about bone marrow transplant, some speak about gene therapy and the likes. Is there a cure for sickle cell?
Yeah, I think I made mention of it earlier on that you can transplant bone marrow is stem cell.
The stem cell.
Can transplant stem cell, bone marrow. Depending on, I don't know where you go, you're going to get it. Once it does not involve killing or taking life, why can't you?
Like the developed nations where probably someone is maybe to be taking off life support.
You can even get it. You can even get it from placenta.
Oh, wow!
But it depends,
Yes, sir.
So it depends on where you get it. So, but wherever you are going to get it, let your conscience tells you that you must not, in an attempt to save your life, kill another life.
Wow. Thank you so much, sir. And that really gives us an overview of the fact that it can thrive even as a sickle cell patient. And I would like you to speak more on the area of stigmatization, because in the developed countries, developed nations, is not as prevalent as how it is in Africa, so to speak. For someone out there watching us that might be a sickle cell patient, and the person is, because we know that for organizations, they ask for your medical reports before they give you a job, or even at the point of settling down and getting married. And they finding out that in-laws to be, or his in-laws to be, finding out that he or she has sickle cell. What should be the approach to situations like that? Because, to be honest, we find people that are even Christians, that the moment they hear this person, even if their own child is AA, and the partner to be is SS, they outrightly say no, even without praying about it. And you mentioned earlier that hear from God. Once God has said something, go with it. So I'd like you to speak to one or two people that might be in such a situation, sir.
Yes, I think the best way to have a sound behavior occasionally is to occasionally visit hospitals. When you visit hospital, you will appreciate God that you are still alive, healed and healthy. When you visit children's hospital also, you will be able to know, particularly if you have never seen a sickle cell crisis before. When you visit those places, you will know, you will appreciate what we are talking about. What we are saying now is look like a talk show, but for you to get the realization, you get to the hospital and see to yourself, can I ever dream to have a child who will be SS? That should be a question. Will you be able to stand it? The pain every time. Will your resources be able to stand it? The pain every time.
Every time.
Now, coming to marrying each other, AA, marrying SS, is good. That's it's advised. But the AA must be able to prayerfully hear from God. Will you be able to sustain her? Will you be able to love her for what she is? Those are questions that has to come on. And I think our religious group should be able to stand in that to ask that question. You know, authentically, will you, this fellow is this. Supposing, you know, we normally say, in love, in sickness, in this. How many people are doing it?
True, sir.
So I think we should be realistic in whatsoever we are doing. But the best SS can do is to marry SS. I mean, so is to marry AA. And not SS or AS. Yeah.
Thank you very much. I believe that has blessed you and you've built knowledge in that regard. So I'd like to ask, sir, we know that there are certain things people in this category or battling this disease are prone to, and there are challenges, there are crises they go through. But are there any triggers, maybe environmental factors that can maybe trigger it? I've once heard of someone that said, oh, whenever it's windy, she tends to have so much pain in her legs and her hands and all. Are there environmental factors that trigger the crisis?
There are. Extreme cold, for instance, can trigger it. Extreme hot, extreme severe environment like hotness, where you get dehydrated. It can trigger crisis. Infection, when you are living in a polluted environment, infection can easily come in. They can trigger that. Well, if you are not eating well, poverty. Poverty. If you won't be able to eat well, that lowers your immunity. And in fact, that lowers your access to the hospitals, the healthcare services. So those are a few things that those environmental factors that can trigger the crisis. In Nigeria here, I know that there are some people that are saying that if you use there's what you call 𝗪𝗪𝗧. Yeah, that stick is peppery. When you put it in your mouth, it's peppery. I've never tasted it, but they claim that 𝗪𝗪𝗧 can lower the frequency of the crisis. Then, and I think I suggest that sickle cell, there should be sickle cell association, whereby they talk to each other. They talk to each other, they advise each other. The association should be facilitated by healthcare workers so that they can teach them, they can talk to them, when necessary. It's very key.
Thank you very much, sir. That was actually the point I was hoping you get to. Them having an association, a body that speaks for them, one, that can time to time enlighten them on new innovations or treatments that are accessible and available to them and to better off their life and their health in general. And so I can say that one thing we've been able to strongly establish today is that being a sickle cell patient or having sickle cell disease is not the end. You can thrive in life, you can have a normal life as far as you do the necessary things to aid it. And, you know, at the inception of today's edition, I said something that healthy living starts from healthy decisions. Decisions to build the right knowledge, to eat well, to take necessary precautions, and as well not to be too far from the hospital. Because going there, like you said, you're just walking in and seeing people go through certain things. I recall my mother once said that she had a backache, and, you know, she went to the hospital to just go for a checkup and all. And she saw people having in more severe situations, and half of the ache had gone just by seeing people in more extreme situations. So oftentimes the reason why we find ourselves, well, I say, stigmatizing people in this, having this challenge, or not having so much knowledge or so much empathy as we should, is because we don't know what they are going through. And it's not our prayer that we find ourselves in such situations. But please, let's not stigmatize. Let's not make them feel less of who they are. And this also speaks to, sir, like you said, to intending couples, even to parents that are to give a say on matters like this, that what is God saying in that situation? What is God's approval in that situation? Is God giving a go-ahead? And from the testimony you shared, sir, someone being SS and giving birth to AA children, that is what God can do. And so as we wrap up, because we've delved into a lot today, and I must say I've learned a lot personally. I believe you've learned one or two as well. I would like you to bring that balance. The aspect of faith. Oh, I want to faith it. My genotype is going to change. And the aspect of science. Because God gave medical practitioners that wisdom to bring about all that we see and all that the health sector provides today. And as well, the place of faith, because we know there is nothing impossible with God. Yeah. We'd like you to bring that balance as regards sickle cell.
Yeah, like, well, faith, God honors faith very well. And God exalts faith very well. But God exalts His word above all. He exalts His word even above faith. He can't lie.
Yes, sir.
He's not a human being that will lie.
Yes, sir.
And so that's why I said, one, you must hear from God. The moment you hear from God, you can go and rest. It doesn't matter. Either you are SS, marrying SS. As far as I'm concerned, medical technology and spiritual technology, they go hand in hand. In fact, where one ends, the other starts.
Yes,
so it's a complementary technology to each other. But I think, well, since we are in the household of faith, we should hear from God. What is God say concerning this matter? And then when you are praying, you pray based on what you hear from Him. Remind Him. Remind Him His word that He has written. Remind Him His word you have heard from Him. That is very, very key. Well, maybe you might be saying, okay, well, how do we hear from God? You have to learn it. How do you get to know the voice of your wife when He's speaking, when you are not there, and you are hearing the voice from outside? How can you distinguish the voice of your wife from the voice of another person? It's by learning. You learn it. And once the moment you are a Christian, the first thing to do is to learn how to hear Him speak to you. I think that's the first thing. And that will help us very well in our journey. And He speaks. He's willing to speak. Of course, He will not speak to you if you are not willing to obey. Because obedience is very key in hearing from Him. So you hear from Him, then you obey promptly. He will speak expressly to you. So I think the first thing is hear from God. What is God saying?
Wow. Thank you so much, sir. I must say I've been greatly enlightened today, and I believe you've been greatly enlightened as well. Sickle cell disease, sickle cell anemia, and knowing what God is saying to you personally, if you're having that challenge, you know someone in that challenge, as well, encourage them. Be God's hands to that person. Show them love. Like our dear doctor has said, pity, empathy, not stigmatization. And you having sickle cell is not the end. You can thrive, you can live a normal life. All you need to do is be informed and do the necessary things. Wow, I celebrate you greatly, sir. Thank you so much for this enlightening session. I believe that 1 or 2, 3, hundreds of people have been blessed today by this, and it gives us a new perspective to the sickle cell disease. I'd love us to know, like I said earlier, that healthy living, a healthy life, starts from making healthy decisions. Are you unmarried and you're considering going with someone having this issue? Ensure that you do the necessary things, even as advised by our dear doctor, who is also a pastor. And that brings a healthy balance to it, the place of faith and the place of science. Are you currently going through the challenge yourself? Please do not lose hope. Do not lose faith. Do the necessary and let your faith give you the strength to carry on. I believe you are greatly blessed today, as I have been greatly blessed and greatly enlightened. As you know, this is You and Your Health, a program designed for us to bring and shed light to life and health issues as it spans from awareness, diagnosis, prevention, symptoms, cure, and maintenance if need be. And I'm certain that as regards sickle cell, you have a new perspective. This program holds every first and third Thursday of the month by 12 p.m. West African time. Ensure you make it a date with God, as you'll be greatly blessed by our dear doctors and even from God Himself. We celebrate you for joining us today. God bless you richly, and bye for now.